Hi, my name is Dr. Desmond White from Desmond White Clinic. Today, I want to answer some question that people ask on the YouTube. Thank you for the comment. So the question asked was, is a non-contrast MRI better for screening in patients with liver cirrhosis, for liver hepatitis B, for liver cancer, or is ultrasound good enough? Yeah, so that's a very good question. We know that first of all, if you have no symptom, no risk factor for liver cancer, we do not generally recommend a screening test. We do a screening scan only when there's a reason to. If we are doing a scan to screen for liver cancer, we typically do it for people with a reason for liver cancer, such as hepatitis B, hepatitis C, or liver cirrhosis from whatever cause. So for people with hepatitis B, I told them in this way. I say that under statistics, roughly 0.5% of the Hep B carrier a year may develop liver cancer. About maybe 0.5 to 1% develop cirrhosis. So we do an ultrasound scan to look for cirrhosis, to look for liver cancer. And most expert opinions say that we should do it once every 6 months. So ultrasound scan, okay? Yeah. So the question asked is, should we do an MRI instead? So to answer the question, first we must understand the limitation of ultrasound. Ultrasound cannot cannot see the whole liver completely well for everybody. That's because our liver is in the right upper abdomen, lower chest and upper abdomen. It was hidden by the rib cage. We put the ultrasound probe there. The probe has to go through the rib, the muscle, to go to the liver. Sometimes patients' liver are very high up, covered partly by the lung. Sometimes they're very deep in, and some patients have a very thick subcutaneous tissue, or their fat, okay? So when they're very thick subcutaneous tissue or very muscular tissue, the ultrasound wave may not be able to go in and out. So ultrasound has a limitation of not able to see the whole liver well for everybody, especially those with a high liver or those who are overweight. Ultrasound is also very operator dependent. I've seen people doing ultrasound by the bedside. When we do an MRI or CT scan, we pick up things that are missed by the ultrasound. So your ultrasound accuracy depends very much on how good or how experienced, how detailed the radiographer or the practitioner is. If the person is not experienced or is not skilled, or the patient being having too fat, or the liver being at an unusual location, sometimes the ultrasound will not be accurate. So to answer the question, first we ask ourselves, is ultrasound good enough? Answer is, I'm sorry, no. Ultrasound is not good enough. Ultrasound is not going to see the whole liver well for everybody. It's going to miss some, maybe small liver cancer, something like that. And second problem about ultrasound is that it will pick up things that we are not sure what exactly it is on the ultrasound. For example, a cyst, a nodule may show up on the ultrasound that you will need further tests to discover. So if the ultrasound is normal, it does not necessarily mean they have no cancer. And conversely, if you see something on the ultrasound, it also does not necessarily mean that they have cancer. So we are not sure. So is ultrasound good enough? Answer is no. How can we improve the accuracy? There are two things that we can do. The first is to add on an alpha fetoprotein. So hopefully when they have liver cancer, they go up and we can use it to help. Second thing is we do a serial ultrasound. That means every 6 months they come back. So I told my patient, well, today's scan is good, there's no cancer. I'll come back in 6 months' time to do the same test, okay? So if your doctor asks you to go back for the same test, do not think the doctor is crazy. The doctor had a reason to do that, because if we do it on a consistent basis, the chance that we miss a cancer is less, okay? Yeah. So ultrasound is not good enough. Ultrasound may miss lesion. Ultrasound is not specific. How can we make it better? Getting a skilled person to do ultrasound will be very important. Knowing the limitation is very important. If the scan can't see the whole liver, the report should say that due to the body composition of this patient, not the whole liver can be visualized. We can say something like that as a disclaimer, and also help the clinician to know whether we should do further tests. Another thing is we can do other cross-sectional imaging like a CT scan and MRI. Now, because we are doing imaging for the liver to survey for liver cancer on a regular basis, we do it every 6 months. Obviously, if we do a CT scan, there may be repeated exposure to radiation, so we don't like it because CT scan got radiation. You do it once or twice a year, not a big problem. You do it twice a year, every single year for the next 40, 50 years, that may be some problem. So we don't like CT scan as a screening. Okay, I say screening because if there's some lesion, we do use CT scan to see the nature of it. So we do CT scan, but we don't like to do it twice a year, every single year for the next 40, 50 years. The next thing will be MRI. When we want to screen for liver nodule, liver cancer, an MRI without contrast, which is cheaper and faster, is good enough. So MRI can see the whole liver. It is less operator dependent. That means you got a competent radiographer, you can probably see the whole liver and the spleen and the kidney and the pancreas. You don't need a very detailed, very technically skilled radiographer to scan the liver with an ultrasound probe. So MRI is more accurate, is less operator dependent. You can also differentiate between cyst and the nodule better. If you pick up a cyst, don't bother. We have liver cysts in 1 in 5, 1 in 10 people in the public. So it's more accurate. The only problem with MRI is that it's more expensive. In Singapore, it's roughly twice the price of an ultrasound, depending on where you're working. And also the queuing up for MRI is very long. That's because people with the neck pain, spine pain, people even with the heart problem, with the brain problem, they all do an MRI. So the waiting time for MRI can be very long. So to go back to the question, what's the best screening method? If I have a choice, if money not a problem, if resources not a problem, I will choose a non-contrast MRI. They're more accurate, they're more specific, there's no radiation, and it's better than ultrasound. Do you think I would do it for my patient? Well, I'll let them decide. We run a private practice. People pay more to get an early appointment. But for the general public, I do not believe any country have the resources and capacity and the money to do MRI without contrast for every single hepatitis B patient. After a long talk, to go back to this particular patient, so should we do ultrasound or non-contrast MRI? Answer is, if resources not a problem, of course, you choose something that's the best, they're better. That would be a non-contrast MRI. But for the general public, for most countries, I believe it will go back to alpha fetoprotein together with an ultrasound scan. I hope I answered your question. Thank you.